to the, okay. Great. Hello, this is the Healthy Mind, Healthy Body, Healthy You podcast, hosted by the Nevada Office of Minority Health and Equity, or NOMHE. We will be releasing a monthly podcast to further educate Nevadans about the human body and improve comfortability of health education and health education access. I am Alex Neal, a Minority Health and Equity Specialist, and one of your hosts for today. We have a phenomenal episode discussing cardiovascular health in honor of American Heart Awareness Month. So let's meet my co-host, Carlos Ramirez, and our phenomenal subject matter expert, Shenakwa Hawkins. Carlos?
Hello, everyone, and welcome to our first podcast. My name is Carlos Ramirez Gomez, and I'm the Program Officer for NOMHE, responsible for fostering community engagement and the development of sustainable collaboratives. I act as a point person to NOMHE, and I'm currently involved in different outreach activities in the state of Nevada. I'm always looking for opportunities where I can collaborate with other organizations. I'm also a contractor with the Southern Nevada Health District, where I act as a community health worker at various outreach events, providing blood pressure checks, health screenings, cardiovascular health education, and providing resources to community members needing health services, diabetes classes, and cigarette smoking cessation programs. The cigarette smoking cessation programs are available free to the public through the Nevada Tobacco Quit program. To get more information on available resources, call the Nevada Tobacco Quit line at 1-800-QUIT-NOW or 1-800-784-8669. And now I'm going to turn it over to Shenakwa.
Hello there. My name is Shenakwa Hawkins. I am a board certified family nurse practitioner and owner at Care with Purpose Medical Center. It is always our job and duty as healthcare professionals in the community to serve with a purpose. Here, of course, at Care with Purpose Medical Center, we care with purpose, on purpose, in order to help people lead and live healthier lives by providing a holistic approach to health and well-being. And so I'm just really excited to be here. Of course, we understand that this is the Heart Month. This is the Healthy Month that we celebrate heart health. And I am excited to speak on this subject matter. However, I am a primary care provider, but we do understand that if we had to go in depth with dealing with any type of heart health, we definitely want to make sure that we're speaking with a cardiologist. So we want to make sure that we shout out our cardiologists out there because they are very important. They are the key people that deal with the heart and heart healthiness. So shout out to all cardiologists, but again, it's always a primary care provider that an individual will see if in fact we need to deal with any type of heart condition. So again, the goal is always to make sure that we're leading healthy lives and helping people to lead healthy lives in the community so that we all can do what it is that we do. And that's just have a better quality of life.
Thank you, Shenakwa, and thank you, Carlos. Today is going to be a fun and hopefully interesting, definitely interactive episode. We're going to start off, just refreshing ourselves on the anatomy of our cardiovascular system. First, let me ask you, Shenakwa, what are the other names for the cardiovascular system?
Well, it just depends on who we're speaking to, where we are, the community that we're serving. And so some people just call it as it is, the heart, right? And other times you may hear it called the coronary system. You may hear people say cardiopulmonary system. There's just so many different names, the circulatory system. There are so many different names when we're dealing with the heart. And so those are some of the key terms you'll hear: the heart, circulatory system, coronary system, cardiopulmonary system.
Thank you. That is a diverse set of names, but I guess like us all, we all have different names for different situations. What are the different sections of the cardiovascular system?
Okay. Well, I mean, keep in mind that the cardiovascular system is a very intricate system. And so there's so many different areas of, it's like you have the veins, you have your arteries, you have your capillaries, you have the 4 chambers of the heart, you have 2 atria and 2 ventricles. And so, when we're talking about different sections of the heart and what consists of the heart, those would be the key elements that we would speak about: your veins, your arteries, and the different chambers. And keep in mind, I mean, the heart is just this beautiful muscular organ. It's really like a pumping system. You have the electrical part of it, and then you have that pumping system. And so it all kind of works together. But I would say that those are the key parts of the heart.
Okay. So you mentioned arteries and veins. I know those are blood vessels. Are there any other blood vessels in the body?
So what do you mean? Are you asking me if there's any?
What are all of the blood vessels, and what do they do?
Have, if you want to talk about the sweet names that we call them, we're talking about like your aorta and your superior vena cava and your pulmonary veins. And
I guess what I'm really asking are like, what are the types of blood vessels? Like, I know there's arteries and veins.
Yeah.
Yeah, and I think there's also capillaries. And then what's the difference between them? Like,
okay,
all go to and from the heart. So
yeah. So the way we remember it is away, arteries, right? So we know that your arteries carry like oxygenated blood away from the heart. I'm sorry, I didn't lose you there, did I?
Nope, you're good.
We're still on.
Okay, so arteries would carry, blood away from the heart, always veins will carry blood to the heart. And then your capillaries kind of get rid of the waste that's unnecessary to be there. And so that's the easier way to remember it. Keep in mind that there is this, the cardiovascular system works with the pulmonary system, and without the two, you wouldn't really be able to have the sustainability of life. And so when we're dealing with veins and arteries and capillaries, we really start to talk about different gases. When is it oxygenated? When is it not oxygenated? What is capillaries really doing? What does it do with the CO2? So there's so many responsibilities in regards to the blood vessels, and they play a key part in keeping us healthy and keeping the body oxygenated. And the organs in the body with its nutrients.
Okay. So you mentioned that the heart is this amazingly complex muscle, and the blood vessels are intricate as well, which makes sense. Is there, I know that there's a basic 3-layer structure to a blood vessel. In
the heart.
And the heart. So what is that structure? If I know there's only so much you could say without a PowerPoint, but what is that structure? And why is it important? Why should we care about the layers of our cardiovascular system?
Yeah. Well, I mean, the layers of the heart play a key part, especially right now in the middle of COVID, right? And so we'll probably get to COVID a little bit later, but there's 3 layers of the heart. You have the outer, the inner, and the middle, right? So your outer layer is what we would consider the epicardium. And the epicardium kind of prevents, major expansion or movement in that thoracic cavity where the heart actually sits, and then you have, and that's that outer layer. And then you have the middle layer, which would be your myocardium. And so the myocardium is responsible for like the contractility or the contraction of the heart to help with what we would consider the cardiac cycle. So I'm just going to jump into that cardiac cycle just a little bit, just to explain it. I mean, and there's 2 phases of the cardiac cycle, and that, consists of like systole and diastole. So most people are like, what's that, right? That's that top and bottom number when we're dealing with the blood pressure. And so with those two phases of the cardiac cycle, without me really going into all of those different systems, I'll try to kind of break it down a little bit. You know, you have your chambers of the heart, right? You have the two, the atria and the two ventricles. And then you have what we would call valves in between. You have, you know, what we would call mitral valves and tricuspid valves and semilunar valves. There's so many different valves, well, not so many, but there's several valves within the heart. And so when we're going through that cardiac phase or the cardiac cycle, when we're talking about systole really talks about the contraction of the heart. And then diastole talks about the relaxation of the heart, and that's the cardiac cycle. And that's where we get those two, the top number of the blood pressure and the bottom number of the blood pressure. So the top would be your systole, the contraction, and the bottom number would be the diastole, which would be the relaxation. And so when that is actually happening, the contraction of the atria has to happen so that, you know, we can, you know, it's almost like we're bringing blood in, pushing blood out, bringing blood in, pushing blood out. And those valves have to open and close in order for us to perfuse the body. And so that pretty much is a simplistic way of speaking about the cardiac cycle. And without, you know, the blood pressure really is our way of looking at the cardiac cycle. So, and going back to what we were speaking of in regards to the different layers of the heart, the myocardium, again, it's responsible for contraction, and that it helps to start the cardiac cycle. Whereas the inner layer, which is the endocardium, that lines the cavities of the heart and the valves that we just spoke of. So that's why it's extremely important. And as we go on further and we talk about, you know, the good heart versus the bad heart, we'll see where those layers of the heart are extremely important and why we need to know what they are. And we need to know when when we're at high risk and what's happening to them so that we're better able to protect them.
Yes, I think that was, well, in my opinion, I thought it was a great example. And when you were explaining it, I kind of started to picture in a way a water hose. And when you squeeze the water hose and the pressure on both sides, and then once you release the water hose, I think majority of people, or a lot of people, remember being outside in the summer, especially if you are native to Las Vegas in 110-degree heat, and playing with the water hose and playing with the water pressure. And I think that's if you're listening, might be a good image to picture when thinking about the heart. Also, there's some really cool videos on YouTube that shows the contraction and release. And you mentioned blood pressure.
Yes. Really quick, I wanted to make sure that people do understand that cardiac cycle, it happens with the heartbeat. So, you know, those all go hand in hand. I'm so sorry. I just wanted to make sure that people understood that. Oh, no,
thank you for adding that. And it actually adds to my next question, which was, you mentioned how when the heart contracts and when it relaxes, this is the systole and the diastole, and this is basically your blood pressure numbers. And if you look at a blood pressure machine, it says SYS and DIA, and that's what it stands for, and the top and bottom numbers. And the blood pressure is one of the important cardiovascular vital signs. And so I just wondered if you were open to it, I'd love it if you could speak towards what are the other cardiovascular vital signs? What are things that you should be aware of and tracking in your everyday life? And then also whenever you go see your primary care physician or specialist and things of that nature.
Got it. Okay. Well, I mean, since we've already went over the blood pressure, so I'll just speak on number one. Yeah, blood pressure is part of the cardiovascular system vital sign, right? And when we say vital, most people, when we come into this healthcare industry, we forget what vital sign really means. We're just like, oh, vital sign. It becomes this trite, right? But really, we're talking about something vital, something extremely important. And what we know is when there's changes in those numbers, then we have to actually start looking at the individual, and there has to be a shift or a change. So for example, if we're talking about the blood pressure, we know that there are certain measures that's a healthy blood pressure, right? So when we look at a blood pressure of, let's just say 120 over 70, we would consider that a normal blood pressure. But when that top number, the systole, the contraction, when that top number gets above a certain number, 130, 140, 150, 200, we're starting to see that this vital sign is extremely important, and now we need to act. The same with diastole, the relaxation when the heart is supposed to be relaxing within that beat. We understand that at that particular time, if that number is over, I start to pay attention at 80, 85, 90, then there's something that we need to do, especially as healthcare providers, to make a shift. But what we want to do is speak to people in the community so that they understand that when these numbers start to go up, and even when those numbers start to go down, we speak of hypertension so much that we forget to really speak about low blood pressure, right? Yeah. Hypertension, that happens too. And because the sign is so vital, we still have to pay attention to that. And when that number starts to go down, we start to have symptoms. So for example, when a person's blood pressure, the top number is like below 100, let's say 90, and the bottom number is below like 50, let's say 45, a person may start to feel really faint, start to experience dizziness, feel as if they're going to pass out, right? We have to start paying attention. Why? Because someone could be losing fluid, someone could be bleeding, you never know. Same with the opposite. If an individual is dealing with hypertension and that blood pressure starts to go up, and those numbers we just spoke of, we start thinking, oh, wait a minute, this person could be having what? A stroke. This person could be experiencing, I should say CVA, stroke, those things. So now we have to shift. So that's why those numbers are called vital signs. It's vital that we pay attention to them. And that's just the blood pressure. And then we have to talk about the heart rate. So the heart rate would be another vital sign. The heart rate would be how many beats per minute does your heart beat? How many times does it beat per minute? Normally that number should be between 60 and I would say maybe 85, right? Sometimes, if you really want to know the numbers, you can always go back to the American Heart Association and the CDC, and they have great charts for measurements that we need to pay attention to. But we start to think when that heart rate goes up and it's above like 95, 100, that's called tachycardia. When that number drops like 60, getting down to the 50s and the 40s, that's called bradycardia. That's when we need to shift. So when we can educate the community on what bradycardia and tachycardia is, there's a better way that they can take care of themselves and people in the community, right? But sometimes we forget about those numbers. We don't know what vital sign really is. Respiratory rate, your respiration rate, how many times do you breathe in a minute? So when we're dealing with adults, we want to make sure that we're breathing between, I would say about 12-14 to about 20-22. When we go outside of that, when we're looking at, a person is starting to breathe at 25 to 30 beats a minute as an adult, they're in respiratory distress. They're in trouble. When someone respiratory rate drops down, again, they're not breathing enough. They're not perfusing enough. Therefore, we need to act. So some of the our people in the community don't know that. And then there's one where we would call, there's two, our pulse oximetry. We want to know what the oxygen saturation is within our peripheral blood system. So we're not looking at it from an arterial perspective, but we're looking at it like, okay, well, peripherally, on the outside, am I perfusing? Do I have good oxygen in my blood based on the number? And we want to always have that above 90. And in the height of COVID, well, we're coming down, we're praying we're coming down. But during this era, everyone spoke of pulse oximetry. Go and get your pulse ox, know that number. And so when that number kind of drops below 90, we're concerned that a person isn't perfusing well. And then a last vital sign that we start to think about that we don't talk about much is pain. Right? You're like, oh.
Yeah, that it makes complete sense.
And Shenakwa, in the case where someone is experiencing high numbers for either their blood pressure or low numbers for their blood pressure, in that case, would someone need to call 911?
Absolutely. So I do believe, like, primary care providers are important in the community, that if you establish a relationship with your provider, right? And let's just say, Carlos, you are a client here. I don't like to use the term patient because it has a negative connotation to it. So if I say, Carlos, you are a patient or a client here at this practice and your blood pressure is high, you notice that your blood pressure, I checked it this morning and it's 150 over 115. Right? You're going to know that's high. Why? Because your primary care provider has now educated you and someone heard the podcast. So, chances are you may call your primary care provider, and your primary care provider may not send you to the hospital at that time. Keep in mind that we don't only treat numbers, we must treat the client. So there's going to be a series of questions that are asked. For example, your blood pressure is high. Do you have a headache? Do you have blurred vision? Do you have chest pain? Do you feel short of breath, right? And so once those questions are asked and answered, then that's going to determine whether the provider is going to send you to the hospital or not. Now, if you don't have a provider and you're asking me a question, Shenakwa, if these numbers are high, does an individual go to the emergency room? Thank goodness we do have a system where we can run those numbers through to people. So if you dial 911 for blood pressure, just what I spoke of, and you gave it to the operator may be able to direct you to like an urgent care center. Or if they felt it was an emergency, a medical emergency, they would direct you to the emergency room. So sometimes we do have those screenings and process that if they did dial 911, they would still be helped. Same with low blood pressure.
Oh, I think that's great. Great. You were speaking about the last vital sign, was pain. Mm-hmm. Did you want to expand upon that in any way?
Sure. So we forget about the last vital sign because we just don't teach it enough. But pain is a vital sign. Pain tells the body that there is something going on, there's something wrong, especially chest pain. When we're dealing with the cardiovascular system, chest pain is probably one of the number one signs to tell you that you're in trouble. Sometimes we don't have a blood pressure cuff to check the blood pressure. Sometimes we don't have the count or anyone that's sitting there with us to be able to count how many times a minute that I'm breathing. Sometimes we just don't have the tools to check our pulse oxygen saturation at home. The first sign we get is pain. And so when you start to experience chest pain, whether it's dull, whether it's sharp, whether it's shooting, whether it's pressure-like, whether it's something like a heaviness in the chest, that is when I would say, you need to call 911 immediately, especially if it's radiating and it's not going away, especially if it's accompanied with signs of sweating, nausea, shortness of breath. When it's accompanied by those symptoms, then you need to call 911 immediately.
Oh, yeah, definitely. That is so completely true. So you mentioned briefly that, COVID has taught us all that we should be aware of how our body works in the systems. Mm-hmm. And it's definitely have COVID-19. If you have had COVID, and if you had long haul symptoms of COVID, for sure, it can and will affect your cardiovascular system. Could you talk a little bit about how COVID can affect your cardiovascular system, or how you've seen it presented affecting cardiovascular system?
Sure. So we do understand that Corona, COVID, SARS, however we want to call this, terrible, terrible virus that has interrupted our lives and our world. We're all tired. We want it to go away. But we do know that this virus is a virus that attacks the lungs, right? And when it attacks the lungs, it causes an inflammatory response in the body. And what we do know is that the lungs and the heart work together. Without the lungs, the heart doesn't work. Without the heart, the lungs doesn't work. We need both of them. They're married to one another. And so you can't have inflammation in the lungs without it affecting the heart. And so when the heart is inflamed, then the heart is not able to function the way it was designed to function. So it affects the arteries, your veins, and your capillaries. And remember, inflammation starts to affect how these veins, arteries, and capillaries, the elasticity in it. And so it will start to harden the veins, the arteries, and the capillaries. And so when those arteries and veins start to harden, then that will itself present cardiac disease. And so it's the inflammatory process that destroys different layers of the heart and the capillaries, arteries, and veins of the heart. So we've seen where COVID has come in and has caused some of people that have contracted COVID-19 to now become hypertensive. Mm-hmm. We see where they have an enlargement in the heart because now the elasticity is no longer there. Remember, we're talking about a muscle that really loves to contract. And now the heart is no longer able to contract the way that it normally does because the inflammation has caused enlargements and a decrease in the elasticity of the heart and of the vessels. And so that's how we've seen COVID affect people in the community and cause cardiovascular disease.
Yes. You were right. Like the cardiovascular system, COVID-19 has many names, and it has a multi-tiered effect on the body, whether or not you're naming it as coronavirus or SARS-CoV-2 or COVID-19. And so with all of these important points about just the anatomy and physiology of our cells, I think it'd be really, it's a good moment to start delving into, well, how do we maintain or increase our cardiovascular health? Carlos?
Thank you, Alex. And with that being said, I'd like to ask you a series of questions relating to maintaining and increasing cardiovascular health. What healthy actions can people take to prioritize cardiac health?
So what actions can we take? Let's see. Lifestyle changes. We have to make sure that we're treating or educating on certain behaviors in the community that affect our cardiac health. So for example, we want to make sure that we teach that it's important to exercise. We teach about diet modification, and we teach about, certain behaviors like, not smoking and not drinking excessively. Those are some of the things that we have to make sure the community is aware of to help promote, good cardiac health.
That sounds good. Some people think that you have to go to the gym in order to work out, but I think, I don't know about you, walking around your neighborhood for, let's say, 30 minutes would be enough to start a process to improve your cardiovascular health. What do you think?
Absolutely. So, sometimes people can't afford a gym membership, especially when we're dealing with the underserved community and when we're talking about who's more at risk for heart disease, and that would be communities of color, right? We are very familiar with that, and who's a high risk community. So when we're dealing with high risk communities, we have to make sure, especially as healthcare providers, that we help an individual to be able to reach their goals and their optimal health based on their own environment. And so that was a good thing to say, Carlos. Like, if a person can't afford a gym membership, well, can you walk outside for 15 excuse me, for 15 to 30 minutes, at least 3 to 4 times, or 3 to 4 times in a week. Can we do that to help promote cardiac health? But here's some of the other things that people can do in their community. How about, stress management? We need to make sure that we help people to understand how to manage their stress. Sleep. I can't say that enough. I tell you, if we can get 6 to 8 hours of sleep, that is so important. The body and the heart needs to rest, right? The other part of that is making sure that you establish a relationship with a primary care provider so that you can get those health screenings. What we've talked about today, your blood pressure, right? You need a blood pressure screening. One important key factor that I speak on all the time is making sure that you check your lipid panels at least once a year. What are your lipid panels? We're talking about your cholesterol levels. What is your total cholesterol? What's your LDL, your bad cholesterol? What's your HDL, your good cholesterol? What are your triglyceride levels? What do they look like, right? And we understand that in the African American community, in the Latino community or Hispanic community, we do see where the cholesterol levels are very, very high. And so most people believe like, oh, okay, well, this is hereditary, but there's still certain things that we can do. It's not always hereditary. It's about environment and lifestyle. So get those screenings. Let's check your A1C levels. What does that mean? Shenakwa, what's your A1C? This is what tells us whether a person may have diabetes or not, right? So when you get with a provider, you want to make sure you do those 3 things. Making sure you don't have, you get your health screenings, your blood pressure, your A1C levels, and your lipid panels, checking your cholesterol, along with exercise, diet, and stress management and sleep.
Absolutely. Those are some great healthy actions that people can do to improve their cardiac health. The next question, Shenakwa, what are at-risk behaviors that can lead to cardiovascular decline?
Yes. Now, smoking, right? Smoking is probably the number one issue with dealing with cardiovascular disease. Excessive alcohol consumption leads to cardiovascular disease. Lack of exercise, inactivity, sedentary lifestyles lead to cardiac disease. Overeating, eating the wrong foods can lead to cardiac disease. There's just so many things out there that can lead to cardiac disease that, we're looking at new things every single day. But the whole vaping, we have to come away from now saying smoking to the way that you inhale toxic products into the lungs, right? So vaping, hookah, smoking, cigarettes, nicotine, all of those things add to cardiac disease, right? So I would definitely say if I had to talk about, 3 important things, it would be smoking, alcohol, and a sedentary lifestyle.
Absolutely, and that's why in the beginning of my introduction, I recommended that if people want to stop smoking, they can contact the Nevada Tobacco Quit program. And again, that number is 1-800-QUIT-NOW. And I'm sure you talked about this in the past questions that we asked, but we just want to ask this, make sure that we know what is heart disease and what are the warning signs and symptoms of heart disease.
Got it. So heart disease really, in a nutshell, is like the diseased blood vessels, right? Structural problems, blood clots, those type of things would be considered heart disease. Diseased blood vessels, we just spoke of a lot with Ms. Neal when we talked about, high blood pressure, what leads to blood vessel disease. When there's a person that has high blood pressure and those blood vessels aren't operating or functioning at its full capacity. The structural problems, when we don't have a great pumping system, when we have problems with the ventricles or problems with the atria, then that's where we may have heart disease. Blood clots, we know that blood clots sometimes come from certain types of arrhythmias. We didn't really speak on that much, but when your heart doesn't beat regularly, where you have these irregular hearts, and an example of that would be something called atrial fibrillation. Atrial fibrillation would be responsible for blood clots that happen within the heart and the lungs. And so that would be considered heart disease. Individuals that have high cholesterol levels. Why? Because high cholesterol levels lead to plaque within the blood vessels. When we have plaque inside the blood vessels, what happens? There's much buildup and buildup and buildup to where then there'll be a total blockage within one of the arteries or within the blood vessel system. And that can lead to cardiac arrest. It can lead to a cardiac disease. I mean, excuse me, a heart attack, which would be like what we would call a myocardial infarction. And so that's one of the number one things that we see. Heart disease is considered the blood vessels and the structures of the heart is not functioning at its full capacity.
And is there a way to reverse that blockage of the arteries?
Well, that's a good question. And I would love to refer that question over to a cardiologist. However, there are things that we can do to prevent the blood vessels from getting clogged or getting blocked. And that's what we spoke of with good lifestyle and healthy choices and behavioral modification when it comes down to smoking, alcohol consumption, and diet modification. So the moment that we start to have a buildup in plaque, we need to make sure that we're getting those screenings, make sure that we have a provider that's there to be able to look at some of those screenings and educate the individual on what's the next step for them, whether that be medication management or lifestyle modification. And so the reversal of heart disease, I don't believe that, once you start to have heart disease, I know that you can prevent it from happening, but when you've gotten to a point or a place where there is a complete blockage, we're really in trouble at that point. So any questions with reversals or what do we do when there's a blockage? Honestly, this is where we're seeing cardiologists. This is where there's now a change in the electrical system of the heart, where that primary care provider can see it and then refer it out to that specialist.
I had to go see a patient. And so, thanks.
And Shenakwa, we're heading towards to our conclusion, and I'm going to ask you one last question regarding cardiovascular health in minority communities. What are cardiovascular health trends in Nevada and for different racial and ethnic groups?
Yeah. Great question. So keep in mind that, heart disease is the leading cause of death in the US. I mean, of course, before COVID-19, but it still remains one of those, leading causes of death in the United States. And we know that heart disease accounts for 1 in 4 deaths in the United States of America. When we're talking about communities in Nevada, especially here in Southern Nevada, we want to be sure that we understand that here, we're dealing with people in the underserved community and communities of color, where there's so many different barriers that that we have in this healthcare industry. People of color and people in underserved communities lack access to quality healthcare, and therefore, they're more at risk for cardiovascular disease, high blood pressure, diabetes, those type of things. And so what we do see, there's a lack of access. There's a lot of institutional racism in the healthcare industry. And so we still continue to see that. But our goal, especially here in Nevada, especially in these communities, are to help change that narrative. We want to make sure that we give people access to quality healthcare so that we can give them an overall holistic approach to help them to continue to be healthy in the community. And so the number one thing I would say, this podcast is amazing at getting the information out there. But not only is a podcast amazing, we got to make sure that as healthcare providers, healthcare professionals in these large organizations, we got to make sure that the people know where they can go to get quality healthcare. Quality healthcare does not just mean that, you get that in these affluent communities. We need to be able to bring it to the communities of color. We need to bring it to the underserved communities. We need to make sure that people are out there identifying racially and culturally with providers. That way we can help people break down those barriers and give them access to quality healthcare so that we can decrease the amount of cardiovascular disease in the communities.
And you have been amazing. Yes,
Carla.
absolutely. You have been amazing answering all these questions. We thank you for your time. And now we have come to our conclusion. Shenakwa and Alex.
Before you conclude, Carlos, I just wanted to give a few quick statistics for our listeners on the line from our 2021 Nevada Minority Health Report. And just so that people are aware, and then I'm going to give it to you to conclude it out and definitely say thank you. The first is in 2019, Black non-Hispanic populations had the highest mortality rates of heart disease in Nevada. And in the Hispanic populations had significantly lower death rates than Black non-Hispanic populations and white non-Hispanic populations. However, white non-Hispanic populations, especially in like Washoe County, had significantly lower prevalence of being overweight and obese compared to our Hispanic populations and our Black populations. And these are just some kind of risk factor statistics that I wanted people to be aware of. Some of these statistics are slightly different with COVID-19, as Shenakwa has mentioned, but they are definitely still relevant, and it's still just important to remember that these health trends have been ongoing for a long time now and for decades, and I just kind of wanted to insert that in there before we completely wrap up.
Thank you, Alex. And with Alex's statistics, we're concluding this episode of the Healthy You, Healthy Nevada podcast series. Today, we learned about the guided anatomy and physiology of the cardiovascular system, how you can maintain and increase cardiovascular health and cardiovascular health in minority communities. If you have any questions related to this podcast, contact NOMHE by emailing us at a.neal, that's N-E-A-L, at dhhs.nv.gov, or you can email me at rcgomez, that's Gomez, at dhhs.nv.gov. And please tune in to our next podcast, where we will be discussing the renal system and how our kidneys function as a filtration system for our bodies. We ask you to please share our podcast with your friends and family, and see you all at our next podcast. Thank you, everyone.
Thank you.